Welcome to our feature on John Hunter, one of the greatest figures in the history of urology. Today, we explore his life, his groundbreaking contributions to the field, and his lasting impact on medical science. John Hunter was born in 1728 in Scotland. He initially worked as an assistant to his older brother, William Hunter, who was a renowned anatomist. John's interest in the human body and surgical techniques led him to pursue a career in medicine. His dedication and curiosity quickly made him a pioneering figure in surgical science. Hunter's meticulous approach to studying the anatomy and pathology of the genitourinary system laid the foundation for modern urology. He conducted extensive research on the vascular anatomy of the testes and the physiology of the kidneys, which provided invaluable insights for future medical advancements. His work in dissecting and understanding the human body was unparalleled at the time. One of Hunter's significant contributions to urology was his research on sexually transmitted infections, particularly gonorrhea and syphilis. He meticulously documented the symptoms, progression, and treatment of these diseases. Hunter's experimental approach and clinical observations helped to improve the diagnosis and management of these infections, which were rampant during his time. Hunter also made notable advancements in surgical techniques. He developed innovative methods for treating aneurysms and pioneered the practice of ligating blood vessels to control bleeding during surgery. His work in vascular surgery not only advanced the field of urology, but also had a profound impact on general surgical practices. Despite facing criticism and skepticism from some contemporaries, Hunter's contributions were eventually recognized and celebrated. He was appointed as the surgeon to King George III, and became a Fellow of the Royal Society. His extensive collection of anatomical specimens, which he meticulously gathered and studied, became the foundation for the Hunterian Museum in London. John Hunter's influence extends beyond his immediate contributions to urology. His scientific approach to surgery, emphasis on empirical evidence, and commitment to advancing medical knowledge have inspired generations of surgeons and researchers. His legacy is reflected in the principles of modern surgical practice and medical education. Thank you for joining us in exploring the life and legacy of John Hunter. His pioneering work in urology and surgical science has transformed the field and continues to inspire medical professionals today. Stay tuned for more stories about the remarkable figures who have shaped the history of medicine.